Good morning everyone and welcome back to Health Horizons. Today we'll be discussing transformations in cancer care and how organisations can support their employees affected by cancer. Let's begin by highlighting why this topic should be a priority for every business. Nearly 1 in 2 people will be diagnosed with some form of cancer during their lifetime. This really demonstrates how likely it is, directly or indirectly, that cancer will affect us all at some point. By 2030, the number of people working age living with cancer in the UK is expected to rise to 1.15 million. So cancer is going to become even more common in the workplace. The encouraging news is that we know around 40% of cancers are preventable. These stats point to a growing challenge for organisations and highlight the need to not only support employees throughout their cancer journey, but also to play a proactive role in prevention. Today we've got a really insightful discussion planned that will explore the transformative role of technology in improving cancer care and the important role prevention can play to lower cases of cancer. We'll talk about early detection tools like genomic testing and the use of AI, and our experts will share strategies that organisations can adopt to better support their people with cancer. I'm delighted to be joined by Dr. Rebecca Rohrer, Bupa's Clinical Innovations and Genomics Director. Dr. Rebecca leads our clinical innovation strategy and has played a key role in developing our My Genomic Health product, which we'll hear more about later in the session. Welcome, Rebecca. Every time you come, that introduction gets longer, by the way. We've also got Dr. Crispin Hiley, Associate Professor and Consultant Clinical Oncologist at UCL and UCLH. Alongside his role as an Associate Professor at UCL and UCLH, Dr. Crispin also works at our Cromwell Hospital, where he provides specialist care with to people with cancer. Morning, Crispin. And Dr. Tim Woodman, Medical Director at Bupa. Tim is responsible for providing clinical oversight and support to the development and delivery of cancer services within Bupa. Morning, Tim.
Morning.
Tim and Rebecca have both had personal experience with cancer, so they'll share valuable first-hand insights throughout the session as well. And as always, please send us your questions throughout the session and we'll answer as many as we can later on in the Q&A. And of course, we'll have those lovely polls you will love so much, so we'll do those as we go through. So let's get started. I'm going to come to you first, Tim. So to set the scene, could you share what current research tells us about the cancer landscape in the UK?
Yeah, certainly, Richard. I mean, it's interesting. At the moment, there are about 3.5 million people living with cancer in the UK, and we expect that to rise to over 4 million within the next 5 years or so. And as you've said, by the end of this decade, there'll be over 1 million people of working age living with cancer. I think what's important to say, though, is one of the reasons why those numbers are so high is because people are living longer. The average survival for all cancers now is 10 years. Now, that's great, but it does mean that there are some cancers where survival is still a lot less than that, and some cancers where survival is a lot longer. But on average, that's improved an awful lot in recent years. Death rates have dropped. They've dropped by over 20%, about 22% over the last 50 years. Which I'm sad to say is over the length of time that I've been in training and practice. And mainly this is because people are more aware of cancer symptoms, there's more publicity around cancer, and also there have been massive advances in diagnostics and treatment, and we'll talk about those later on. It's not all perfect though. We still only have about 54% of cancers being diagnosed early, and obviously the earlier you can diagnose cancer, the more likely you are to be able to treat it effectively. And that figure has remained pretty stagnant for the last 10 years. Screening programs are also helping. They save thousands of lives annually, particularly the screening for bowel cancer, the FIT test. We're seeing a drop-off now, though, in people attending for breast screening and cervical screening, which is a little bit worrying. There are other cancers for which we don't currently have screening programs.
So lots of advancements, but plenty more to do.
Absolutely, yeah.
So, Crispin, around 1 in 4 cases in the UK are preventable. Alongside lifestyle changes, what other preventative measures or screening innovations do you see making the biggest impact in reducing cancer cases?
Yeah, no, I think it's a great opportunity that there are preventable cancers out there, and I think we shouldn't underestimate lifestyle interventions. That even though we're talking about other things here today, I think lifestyle interventions are key. So not smoking, supporting patients or people with smoking cessation. They're thinking about healthy diets, regular exercise. All of those things are really important. And then beyond those critical things, it's really about having access to a GP for symptoms when you have symptoms that may be associated with a cancer, to see someone quickly. And it's really difficult being a GP. Okay, most of what GP sees are not cancer, and it's a really hard job. And so it's really key to try and see your GP as quickly as you can. If you have symptoms that you're worried about, it's good to go back and see your GP again if those things don't resolve. And I think the great thing in the UK is that we do have a number of screening programs, and certainly the big thing at the moment is lung cancer screening. One of the things I do a lot of is looking after patients with lung cancer, and I think it's great in this country that we're rolling out a national lung cancer screening program. Certainly in my part of the world in North London, it's the first place to have completed all of the screening of all the eligible patients, and that's great for people who fall into that category, which is sort of 50 to mid-50s to mid-70s who smoked, and it's an evidence-based way of detecting cancer earlier and making it more treatable and more curable. But unfortunately, not every person falls into that category, and so we're starting to learn a bit more from, particularly in lung cancer, from around the world, where perhaps lung cancer is more common in people who've never smoked, how we might try and think about sort of lung cancer screening in those patients who haven't got sort of classical risk factors like a smoking history.
Yeah, that's really interesting how it sort of evolves and develops over time, isn't it? Obviously less people smoke now. Also, the point around GPs is quite interesting, isn't it? Because they often get quite a bad rep, but you don't think about the fact that they see hundreds of people all the time with, I
mean, I always said, I think in a way, my job is relatively straightforward. By the time patients come to me, they have a diagnosis. I'm an oncologist, and so then really it's about supporting those patients, picking the right treatments, getting them in the right sequence, and getting them to that treatment as quickly as possible. But I think, being a GP is a difficult job, generally, and I think it's a lot of the GPs, particularly for rarer cancer types, they might only ever see one of them in their entire career, and that's the challenge.
Yeah, absolutely. Okay, so coming to you, Tim, what's the business case for investing in prevention, and how can predictive analytics help reduce high-cost cancer claims?
I think it's really important to emphasise that actually good preventive care makes sense to businesses. If you can help prevent cancer starting in the first place, that obviously will reduce the demand for treatment, reduce costs overall, which if you're buying insurance for your employees is obviously going to make that cheaper. And any employer can provide access to exercise, access to healthy food and drinks, and encourage active social networks at work. All of these things help to raise awareness as well as preventing or reducing the risk of getting some cancers. Now, we use a lot of analytics in insurance, and these things now can start to identify who is at particular risk of developing certain cancers. These are predictive analytics. Now, what they will do is they can enable you to make targeted interventions, maybe invite people earlier for screening. For example, it's been shown that if you've got a high predictive risk score, a polygenic risk score for breast cancer, that's the same as having a BRCA mutation for breast cancer. Significantly increases your risk. So you might want to get your employees to have their breast screening earlier. It also enables you to make more informed decisions for them about other lifestyle interventions. And if you can get diagnosis earlier, that means that treatment is probably less invasive, it's more likely to actually be curative, and it actually means that your people won't be off work for as long. So that, again, that all makes sense. And I think all employers can use their regular staff communications to raise awareness of cancer, awareness of what the risk factors are, and where to go for further information if they need it.
So again, about setting up the environment correctly to encourage all the right behaviours, isn't it? I think.
Absolutely.
But, so Rebecca, how can advances in data and technology help identify people at higher risk to cancer earlier? And what does that mean for prevention?
It's such an exciting time to be working in this space. There's so much in the technology space that's on our radar. I think a couple of things to highlight. I think AI analytics, super exciting. This is using AI to be able to analyse really big data sets. The inclusion of medical records, of pathology images to be able to better identify people at risk and then better risk stratify those who are being diagnosed. I think there's legitimate concerns about, the use of data and, people's willingness to be able to do that. But these are validated medical tools. Data is kept really securely. So that's very much something that we're considering. I think digital pathology is also something. So that's the use of, images taken from biopsy, and then the overlay of AI algorithms to be able to analyse those better, to be able to detect these really subtle changes, that the naked eye, may miss, or it might be really difficult to do that. And that allows us to be able to better diagnose and also to be able to reduce the rate of misdiagnosis within those. Genomics is obviously an area that we're heavily invested in. I think we're going to speak about that later, so we'll deep dive then.
Great, thank you very much. So lots of stats in there, they're completely eye-opening, and it just shows how important it is to understand our cancer risks to inform how we manage prevention. And the more we know, the better choices that we can make. Right, before we move on, we're going to get to our first poll, eagerly awaited, I know. Do you believe your organisation is doing enough to help employees understand and reduce their cancer risk? Yes or no? We'll tell you the answer later. Well, not the answer, what you came up with, more like. Okay, let's move on. So now for the next part of the session, we'll look at how technology is transforming cancer detection and treatment, driving better outcomes for patients. We'll also discuss practical ways to support employees returning to work after cancer, and take a look at the exciting innovations on the horizon. So, Crispin, I'm going to come to you first. What challenges are patients facing in accessing timely care, and how can private healthcare complement NHS pathways?
Yeah, I think it's a good question. I mean, I think as physicians, what we care about is getting patients the right sort of diagnosis and treatment as quickly as possible, because we know that early treatment is in general associated with better outcomes. And in the UK, we have the NHS, which is a fantastic institution, and the NHS has set itself sort of relatively ambitious targets for time to diagnosis, time to treatment, and unfortunately we're not meeting those in most geographies in the country. And so I think there is a place for people who have private medical insurance and wish to use that to get a diagnosis, and because there are situations where getting that diagnosis as quickly as possible is meaningful, certainly both in terms of long-term outcomes but also in terms of patient anxiety. Okay, I think we all know that there's that period in between a diagnosis, or that period before patient starts treatment. It generates a lot of anxiety for patients and families, and everyone, whatever healthcare sector they're working in, and I work in both, are trying to do everything they can to minimise that. And certainly in the private sector there are certain bottlenecks that have been addressed in terms of things like reporting of scans. That's often something that can happen more rapidly in the private sector, and again, as we've talked about, digital pathology, so digitising pathology slides, and being able to prioritise those, perhaps using different sort of AI models, so that a pathologist can get to the most important ones quickly, because in reality we don't have enough pathologists in this country. We don't have enough radiologists to read scans. We need more oncologists. You look at the workforce planning, we need to employ more consultants, and so that puts pressure on the system, and I think it's just good for patients, people who either are worried they have cancer or have a diagnosis of cancer, to be able to find a pathway that gets them a diagnosis and treatment and helps them and their family.
Yeah, absolutely. Tim, coming to you then. So at Bupa we have our Cancer Promise. Could you outline what this means for our customers and what support is available at each stage of the cancer journey?
Yeah, certainly. I mean, in a nutshell, the Bupa Cancer Promise kind of means we've got this, we'll be there for you. Obviously, I would say that, wouldn't I? I work for Bupa. Yeah. But, I've got skin in the game. I've been the other side of the fence with this, and I've used Bupa to deal with cancer, and it's been amazing. So what do we actually offer? Well, if you're diagnosed with cancer, or even if you're worried that you might have cancer, you'll get support every stage of the way. For example, if you are a Bupa customer, you're worried you might have cancer, you can access expert advice, and you can do this by speaking to a digital GP using the Blue app. by going to a Bupa clinic and speaking face to face with somebody. Or if you're worried that you might have skin cancer, we have a remote skin assessment service which provides very rapid diagnosis and reassurance. And I think the key thing, Crispin said earlier that, GPs don't see a lot of cancer, and I was a GP for a good number of years, and it's really important to point out that when people think they've got cancer, 90+% of the time they haven't. So what we can offer is rapid access to reassurance as well as to diagnosis. And we do this, one way we do this is through our specialist centres. We've got specialist centres for breast cancer, bowel cancer and prostate cancer. These enable you to have rapid access to a specialist, get the right diagnostics as quickly as possible, and in some cases to get the reassurance that you haven't got cancer on the same day you're there, and certainly within a couple of days. At the same time, if there's a possibility you have cancer, you can move on to more detailed diagnostics and then on to treatment. And typically, if you do need treatment, for Bupa customers in our breast centres in particular, we're seeing treatment starting within 31 days. That's half the NHS target, and that's a target that the NHS hasn't hit for over a decade. So, we're really proud of that. And obviously, I know from experience that cancer can take a real toll of your mental health as well as your physical health, and also of those around you and your loved ones and your friends and your family. Now, Bupa customers with cancer have got access to 24/7 mental health support, again through our own provision, whether that's counsellors, therapists, if needs be even psychologists. So it's a whole wraparound proposition, and it very much is, Bupa's holding your hand all the way.
Great, thanks. So I think we were saying from what Crispin really well articulated around the worry around cancer, we're trying to take that away, and whilst you're never going to take the worry away, it's around getting some certainty as quickly as possible and giving people that support.
Absolutely.
Yeah, great. So Rebecca, how is genomic testing transforming cancer care from improving early intervention to reducing unnecessary drug use?
Genomics is an amazing tool because it allows us to kind of use those inherited genetic predispositions to be able to understand risk. Risk in healthy individuals around, their likelihood of developing cancer in the future, but also that interaction between their genetic risk and their lifestyle risk and how that kind of combines, and therefore what they can do to prevent it. I think during treatment, cancer genetics are also really interesting because it allows us to be really precise with the treatment that we give, with how we follow people up. So, I think across those two areas, it really acts not just to prevent cancer in the first place, but then to be able to diagnose it at an earlier stage, and then to be able to treat it even more effectively with precision, and also to reduce the toxicity of some of the cancer treatments. That means that people are better able to tolerate treatment, and to be able to maintain a really good quality of life during treatment as well.
Great, so getting on to it sooner potentially, but also much more specific treatment feels like that. Yeah, okay. Crispin, recent reports show a 626% rise. I wish we could have that in my sales figures. Recent reports show a 626% rise in robotic-assisted procedures across the NHS and private sector between 2017 and 2024. How is this technology transforming cancer treatment outcomes?
Yeah, no, I think there's lots of great technology transforming cancer outcomes, and robotic surgery is one of them. I'm not a surgeon, but I work with many who do have access to the robotic surgery, and certainly in that scenario it allows sort of more minimally invasive surgery, both for things in the pelvis but also things in the lung. And so patients are in and out of hospital more quickly, less side effects from surgery, less complications. Those are the main rationales. But we have technological advancements in other areas too. Robotic bronchoscopy, so being able to take samples. I'm a lung cancer doctor, being able to take samples from other parts of the lung more easily to get a diagnosis from perhaps areas that were more difficult to reach. Again, even in the treatment perspective, again, one of the reasons that I got involved in healthcare in the private sector was to access technology that I couldn't access in the NHS. And radiotherapy is an advanced technology, MR-guided radiotherapy, so MR-Linac, where you have an MRI scanner built into a radiotherapy machine, allows you to give really precise treatment. Not needed for every single patient, but when it is needed, it's really useful. We do have access to protons in this country, another form of advanced technologies, which for certain patients is useful. And again, it's having access to experts who understand when you need that and when it's not necessary. And as Rebecca has said, again, genomics, another advanced technology, rapid advancements in the last 10 years. Being able to sort of stratify patients who have a cancer into different groups. So it's not just a lung cancer, it's a lung cancer with a certain mutation. I remember, lung cancer, 10, 15 years ago, there was, 1 or 2 treatments, okay? And now we have many and more emerging different slices of lung cancer with different targeted treatments, different drug treatments. And again, as Rebecca has said, is the sort of the emerging technologies of circulating tumour DNA, being able to track markers of a patient's cancer in the bloodstream, potentially allowing us to detect recurrence more earlier, and now we're sort of working out how to use that best and doing trials to work out how we treat patients effectively, combining all of these different pieces of information, circulating tumour DNA as well as imaging, as well as clinical assessment. So across the board, I think it's a really interesting time to be working in healthcare. There's lots of great advancements, not just around AI, even just without AI, there's some really fantastic technology. And obviously, when you layer AI on top of that in terms of how it might help us, stratify patients and prioritise different investigations, I think it's a really exciting time to be working in healthcare.
Great. It feels like all of this technology is just enabling us to be much more specific about how you treat an individual. Would that be a fair sort of reflection, regardless whether it's genomics or different tech and so on? Cool. Okay, so where am I going next? Coming to you, Rebecca. So we've heard about the impact of genomic testing. So can you tell us exactly how Bupa has implemented this innovation into our services and what specific products are currently available to our clients?
I think the first thing to say is that we've implemented it carefully. So we've just come to the end of a big trial. We're actually running the biggest private sequencing project in Europe with our colleagues in Spain and in Poland to do whole genome sequencing on a healthy population, so asymptomatic population. That's yielded some really interesting results. We've done just under 15,000. So 5.7% of those people showed a high risk variant. That's something like the BRCA gene that people might be aware of. And we've certainly had numerous individuals who've gone through, preventative surgery to be able to prevent a cancer from occurring potentially in the future. 77% of those individuals have had a raised polygenic risk score. That's where lots of genes combine together to increase your risk of something like diabetes, cardiovascular disease, breast cancer, prostate cancer. 100% have shown some genetic variants to how they might respond to common medications, things like antibiotics, ibuprofen, antidepressants, but also some of the chemotherapy agents that we use. And 91% have shown some risk related to lifestyle, to nutrition, to activity. Yeah, I'm a GP. I spend a lot of time talking about the kind of commonsensical things around prevention, but it's really difficult to do that. We get that, right? Everybody knows what to do, but it's actually really difficult to implement it. I think the beauty of these genomic recommendations is it's truly personalised. And actually, because we relate it to future risk, actually we're seeing that people's ability to be able to implement that advice in a meaningful way, whether that's losing weight, whether that's reducing alcohol intake, stopping smoking, is really good. We've launched 2 products off the back of that. So we've launched something called Medication Check. That's a little saliva test. People can do at home. They send it away. 2 to 3 weeks later, they get a report that shows how their genomics interact with medication that they either take at the moment or may take in the future. That comes with some GP time so that we can contextualise that information so that people have the time to be able to answer any questions and we can make any prescribing decisions off the back of that. We've also integrated some polygenic risk scoring into our health assessments. So for people that meet certain criteria, we're now able to do polygenic risk scoring for prostate cancer, for breast cancer, for cardiovascular disease and for diabetes. Again, just so that people can have a really well-rounded understanding around what their future risk is and how that relates to their current measures of weight and blood pressure and all of the things that we know that we should be aware of.
Yes.
And I think that's really interesting, isn't it? Is that, as you say, it's sort of you have these advanced tests like this, which is fantastic, and obviously it's done in the context of access to genetics advice, but actually it's sort of about nudging people in the right direction, isn't it? To live a healthy lifestyle and do the right things, and and it's sort of, in a way, there's all the sort of wearables that many of us have. One of the things that they do is to really to really nudge people in the right direction, so that they know, okay, well, I need to move a bit more, I need to sleep a bit better, I need to eat better. And I think it's all of those things just ultimately help nudge people towards a healthier lifestyle, and then taking symptoms that they may have more seriously and going to the GP and not sort of putting it off, because particularly in the workplace, everyone's busy. We've got jobs, we've got families. You're always connected to work with your phone, and so it's very easy to just sort of not think about your own health, and sometimes these things just help nudge people towards making sure that they stay healthy and that they don't ignore things, and ultimately I think that really does result in early detection of cancer when it is there, and that remains key, all right, regardless of all the advancements we make in advanced disease and treating patients who've got stage 4 cancer, and there's some wonderful things there. The key thing is really is early diagnosis.
Yeah, absolutely. And if this helps one person get in and change their lifestyle, I mean, on a human level, everyone wants to stay well and fit and healthy, don't they? So I have to say, I had a genetics test. I was quite nervous about it to start with, but getting your head around these are risk factors, not a diagnosis, is an important one. But also the medication check, I think, is great. If it flags up what's going to work and critically what's not going to work, then it helps you get to the answer quicker, doesn't it?
Yeah. I mean, we've talked about this move to prevention for so long in healthcare, but actually we're still really reactive, right? So anything that we can do to just make it, okay and normal to have a conversation around, this is what's normal for you, this is what you need to look out for, these are some personalised adjustments that you can make in your own life to be able to be healthy in the future. I think that's all for the good.
Oh, I didn't even know fatty liver disease was a thing until I got to it. I'm onto it now. Okay, coming back to you then, Crispin. As a professor, I imagine you're always looking ahead. Are there any other future trends that come to mind?
Yeah, I mean, as I said, it's a really interesting time to be in healthcare. I mean, there's lots of things that are already here. I think some of the AI tools, so ambient AI, so listening devices in consultations so that you can really focus on a conversation with a patient. I think that's really key. Really enabling for doctors to be able to sort of build those relationships and hear everything that the patient's saying. That's great. Not constantly having to type on a computer or write notes. We're already using AI, in some of the lung cancer screening scans that are done to sort of prioritise which ones need to be looked at first. So AI is here and already being implemented in healthcare. But certainly, I think there's lots of things coming. I think we're sort of early cancer detection tools, so blood tests, along with both sort of things that we might find in the blood that are an evidence of cancer, but also these polygenic risk factors. I think how we integrate all of those things is something that's really emerging. But also how we use AI to assist with sort of, particularly in my area, radiotherapy. How we sort of might use AI to assist with planning and delivery of those treatments to sort of get that treatment delivered more quickly, I think is a really exciting area. And then, I think again we've talked a bit about different different types of cancers, and not just having a lung cancer or breast cancer or colon cancer, having really defined subgroups within that. I think that will continue to expand. And also, we're learning more and more about cancer every day. I mean, the immunotherapies that we use for cancer will change. We're starting to see a lot more trials of cancer vaccines being led both commercially but also by academic institutions, where I am at UCL, and I think those are potentially could make huge impacts for patients with cancer.
Great, fast changing. So Rebecca, coming back to you, beyond genomic testing, what other innovations in personalised medicine are you most optimistic about, and how could they change cancer treatment outcomes?
I mean, I think a lot of this we've covered, but what I'm interested in is what can improve the lives of the consultants delivering the care, the teams delivering the care, and then what actually do you need from a patient perspective to help them feel kind of orientated and cared for? I think on the delivery side, we've talked about circulating tumour DNA. So that area of kind of liquid biopsies, of multi-omics, of using lots of different information to be able to enable real-time monitoring, to enable monitoring before we can recognise it on scans, etc., is going to become really powerful. The use of AI to be able to build these predictive models using imaging pathology, molecular data, kind of drawing that all together to be able to better risk stratify, who's at risk and how they're going to respond to treatment. There's a really interesting area emerging of digital twins, where essentially this idea that we have a digital twin where we're able to trial different treatment regimes to be able to assess how we might respond to it. Some of this stuff is certainly in the distance, but it's starting to emerge, and it'll come before we know it. And I think this area of immunotherapy to be able to better tailor treatment to individuals. But actually, for me, it's about using that exciting technology and being able to translate that so that customers feel really cared for. And there's going to be a lot of uncertainty within that. There's going to be, well, we could do this, we could do that, and communicating that correctly to patients.
And I think that's really challenging, right? Is you need to have people who are, who can articulate the uncertainty, with some of the newer technologies, and so that, nothing is ever always or never, all right? You have to be able to articulate that, and to truly understand that is really important. So you need both, you need physicians who are literate in modern, healthcare advancements, be it genomics, be it AI, be it pathology, digital twins, and all these other things, foundational models, really exciting things. I work on some of this from a research setting. But and that's fantastic, and you need literate physicians. But you also need fantastic support staff. You need really good nurses, cancer nurses, nurses throughout the diagnostic pathway to just support patients, because often if patients may be going through investigations for cancer, or there's just a lot of, as we've said before, anxiety and uncertainty. And so alongside all the advancements and exciting tools, we need to make sure that the communication pathways are in place, and there's great technology to support that as well, so that patients can be can communicate and can be monitored and supported, and all the other things that are important when you're going through this process of sleeping well and being supported for that, and all these things that as oncologists sometimes when we're in the deep down in the nitty-gritty of genomics, and it's very easy to miss that the patient actually just needs a bit of help and support.
Yeah, great. I mean, the advancements moving so fast sounds like an exciting time for the individual. Personalised health, much more specific. We talked about the wraparound care a lot as well. I'm interested though in what employers should be doing or could be doing to support their people, and what steps could they take to really get into this space. Anyone got any views on that?
We've heard a lot about, from a scientific background, basically, of how cancer is becoming much more defined and fragmented into specific little subtypes, and how we're looking at the person as well as the tumour. So what we're coming out with really there is we're all different. Our cancers are all different. And I think from a personal experience point of view, you need to bear that in mind. You can sit there as a patient who's living, or a person who's living with cancer, because you kind of cease to be a patient at one point, with your little box of pills, with your calendar that says when you're going to have your radiotherapy and when you're going to have your chemotherapy, and you can plan all of that. What you can't plan is for the day when you don't want to get out of bed, or the day that you're throwing up. And I think to support people, for organisations to support people, you just need to recognise that unpredictability. You can plan the treatment, but you can't plan the side effects. And also, nothing's ever normal again. So somebody might come back to work and you might think they're absolutely fine, they're behaving just like they did, but you never quite know what's going on inside them. So for employers, it's very much about being flexible, being empathic, understanding the uncertainty, understanding the fact that there's no good asking somebody questions about what's going to happen next, because they may not know themselves. So it's just being understanding and being flexible and adaptable. So, I think all this stuff is absolutely great, and what it is going to mean is there will be more and more people living with cancer, because ultimately we would like, obviously, to reduce the incidence of cancer, prevent cancer 100%, who knows? But there's a massive lead time on that, because there's a lot of people like me around, and it's the 20-year-olds who can adopt the healthy lifestyle now and not get cancer later on. So there will be a long period when the number of people living with cancer goes up, and they're living longer with it, and that will have an impact on them and on their work.
Yeah, absolutely. So, supportive, all the right behaviours, but also where someone is in that position where they're coming back into the workplace, it's about knowing them, like most things we talk about on Horizons, knowing your people, creating the right environment, being curious, supporting them, etc. So,
And I think it's really important. The time to get to know people is not when they're going through cancer treatment. It is before. Yeah. It's about leaning into your health assessment data. It's about leaning into, the their approach to stuff like genomics. That's going to make you understand, what is your employee's approach to risk? What is their approach to, making lifestyle and physical changes? And then that's going to allow you to be able to create, really good plan Bs, that if the worst comes to the worst and you have somebody who's diagnosed with cancer, these are the sorts of things that work for that employee specifically, but for, of course, the other employees around them, because it has, waves, seismic effects, these kinds of diagnoses, absolutely. Right?
Yeah. And I often say, to patients, that I almost actually think the hardest part is after the treatment's finished, right? It's, when you're having the treatment, that's difficult. But actually, we're really good at, I think, at managing side effects from treatment and supporting patients through that treatment. Often it's that period afterwards where they're under follow-up, they're having regular scans, and, maybe in the future more regular blood tests for, things we've talked about. But it's just that period of uncertainty, and I think having the flexibility that to patients who've been through that they know that they can have some flexibility in the workplace to access the sort of healthcare that they need or support that they need, particularly if they've got young families and all that, and things like that. I mean, it's incredibly challenging for people to go through all of that and then go back to work. And I think it's just I'm always amazed when patients do. Some of the patients I've met along the way of superbly professional people who have amazing jobs, and they go through all of that and they go back to work, and I find that really inspiring. And I think it's just about having a workplace where we, where that's permitted and that's supported, and people feel like they have the time to take care of themselves and access healthcare and support when they need it.
So having the right environment that encourages people to invest in themselves, have their own well-being, being flexible, and having the support mechanisms there where they need it. Okay, great. Thank you very much. So we're going to come to your questions in a second. So I've got a few, but get more in if you want to ask them. And before that, we'll come to our next poll. So would you feel confident that employees in your organisation could get fast access to cancer diagnosis services if they needed it? Yes or no? Okay, so questions from the audience. I'm going to come to you first, Crispin. So how are new technologies and treatment options tested before they're available to the public?
Yeah, no, it's a good question. Everything will go through, a trial. So there are always some trials. So, there's very early trials just to look whether a medicine's safe or a treatment is safe. And then there's, more advanced trials where we look at how well that treatment might work. We practice evidence-based medicine, so we're only going to use treatments that we think will help. And there's evidence for that. Now, the problem is that every patient is different, and so every patient doesn't necessarily fit into the criteria of a clinical trial that was done. And so this is where sometimes you have to sort of use the evidence base that you have and apply that to an individual patient. And there are absolutely circumstances where the level of evidence doesn't perhaps meet what the NHS thinks is they want to see to sort of make it nationally available, but actually there's good evidence and randomised data that is a helpful treatment, a drug or a radiotherapy treatment for patients. And then that's where I think Bupa have genuinely been very sensible, where we can have this open dialogue about is this in the best interest of the patient, and I think every oncologist in the UK is a very sensible oncologist, right? We're all trying to do things that we think will help patients, and so yes, we have all these great tools, but we only deploy them when we think it's in the best interest of the patient.
Yeah, absolutely. Okay, thank you very much. So Rebecca, coming to you, sometimes a journey for a cancer patient is disjointed. What are Bupa doing to ensure a more seamless journey?
So I think part of that is around limiting that uncertainty at the beginning of the process. So, speaking as a cancer patient in the past, that uncertainty at the beginning is really, really difficult. So just by, having pretty seamless access, a quick diagnosis, minimising that period of uncertainty until you can start treatment, I think is really impactful. I think, the phone line services that we have in terms of Anytime Healthline, in terms of the specialist oncology nurses, is really important, because that means that if you wake up at 2:00 in the morning and you've got those concerns and you've got questions, actually there's somebody to talk to, right? That's really important. And I think also all of the wraparound services in terms of, the mental health support, in terms of the GP support for strange symptoms like that you might get, that you don't know if it's associated with your cancer treatment or not, things like fatigue, like brain fog. I think that's all really important. And then I think actually that dialogue and that relationship that you have with the clinical oncologist is a very, very close one, actually. You're entirely dependent on them. So just being able to have really good access to a clinical oncologist who you can trust, who you can build that relationship with, is absolutely critical.
Great, thank you very much. Okay, Tim, coming to you now. So how can we support our workforce from a proactive angle with cancer awareness and detection?
I think events like today are obviously massively helpful, but I think also signposting your staff, people who are worried that they may have symptoms suggestive of cancer. There are reliable information sources like the Bupa website, like Prostate Cancer UK, in my case, like the NHS. So it's very important that you're able to signpost people to the right sites, not rely on them just going off and Googling things on their own. But also poster campaigns in the workplace, social networks, social media networks within the workplace as well, where people feel able to speak more about what's happened to them and what their concerns are, and where there's a lot of peer support built into those. I think those things are really important. But I think also fostering a healthy lifestyle environment at work. If I was horrified when I walked into an NHS hospital not that many years ago, and there was a Burger King just inside the entrance. Other hamburgers are available. That is not a good look for a healthcare facility. So encouraging people to eat healthily, drink healthily, have breaks when they can exercise and go out and get fresh air. Just having a positive atmosphere at work means that people are more likely to be able to open up about their concerns.
Great, thank you very much. I can't quite believe that, but anyway.
But I think Tim's right. I mean, I think even if what workplaces are doing is signposting, people to what screening programs are available, I think that's huge, right? If by having today, means that some of the workplace staff here go out and see, do the staff we have working for us know that they might be eligible, that they fall within the criteria for lung cancer screening, right? That could be huge. I mean, that literally could save lives, right? Just from today. And so sometimes just pointing people in the right direction, making sure that they're aware what they are eligible for, is a big thing, and that is a responsibility I think that workplaces do have.
Didn't even know that people were eligible for lung cancer screening. What
gives
you access to that?
Exactly, and this is the thing, isn't it?
Yeah.
Is that actually sometimes the simple thing is just saying the same thing over and over again so people don't know, because everyone's busy. We've got busy lives. You just don't know. That letter comes through, you miss it. You don't see the text message, and so I think it's just sometimes just saying the same thing over again to staff and supporting them to access whatever screening or lifestyle interventions might help them is a really important thing to do.
Yeah. Great, thank you. Okay, Rebecca, this is a double header, but both in genetics. So actually I'll ask one at a time. So is medication check available for everyone, members and non-members? If so, how do you go about getting one?
Yeah, available for Bupa members and then people who aren't Bupa members as well. And it's, you go onto the website, you order it, put in your details, and then it's a small box that comes through your letterbox. It's a 2 ml saliva sample and then free pre-postage back. So readily available. I'm sure we can send out a link afterwards potentially.
Thank you very much. Cool. Yeah, on the Bupa Academy.
Yeah.
Okay. And then secondly, if a family member has cancer, how do you go about getting tested to see if you're genetically more at risk of developing cancer?
So it depends on the type of cancer and it depends on your individual circumstances. So my recommendation is always that if you've got questions or if you're worried about it, As a GP, I say, if you're worried, I'm worried, so come and talk to me about it. I think GP is often a really good first port of call to be able to identify what your next step might be and whether you might be eligible for any genetic kind of screening. The criteria can be quite tight in the NHS, so I think it's always worth speaking to your GP. We know that certain populations, like Jewish people of Jewish background, for example, eligible for free BRCA screening, for example. But it really varies by different cancer types.
Okay, great. So
and lung cancer is, again, is a good example of this. We know that for people who don't smoke, that there is a risk associated with family history. So again, a lot of the screening that's done in Asian countries of people of Asian origin are based on a family history, because we know that's a big risk factor. Now, we're not 100% sure what the variants are in the germline that's associated with that risk, but we know that there are some there. And so I think you can do these tests. You need to have access to someone who can help you interpret that test, and that's what the system is designed to do. Yeah.
And I think that's really important, is having these tests just as part of a process. So you need to have a discussion, an informed discussion, before you even think of having the test, and particularly an informed discussion afterwards to look at the results. You can go online and you can buy a genetic test. I can go online and buy a spanner. It doesn't mean I can repair a Ferrari. Yeah. There's a lot more to it than just having the test.
Yeah, absolutely.
Yeah,
absolutely.
And the test, those genetic tests are not always slam dunk. It's always like, it is the risk of developing it. It's not a crystal ball.
Yeah. Absolutely.
So it may not provide the certainty that you want at that point.
It's probably better than Google, though. Cool. Thank you very much. That's all of our set questions. Is there any final builds any of you would like to make before we?
I just think we're in a really exciting period at the moment. We've talked about a lot of different technologies, and they're all starting to come together. And actually, once they all come together, the potential is limitless. We can use AI to design drugs, rapidly reduce the amount of time it takes to bring a drug to market. We can look at the side effects of drugs and re-engineer drug molecules to get rid of those side effects. Radiotherapy, Crispian has said, radiotherapy now, I've seen some of the kit that he uses and it blows my mind. So we're at a really exciting time for cancer treatment. The C word is a horrible word, but actually, if you want to talk about it as a battle, it's a battle that we're winning. Great.
Well, that's it.
And I think that's true. I'd echo that, and it's an exciting time, and I love all the great technology. I'm a a real geek when it comes to genomics, radiotherapy, precision medicine. I really am, but and those things are fantastic. But ultimately, it still comes back to the idea that actually lifestyle intervention and early detection of cancer will make a huge difference, right? If you focus on that as an employer, that's the thing that's going to make the big difference. Yes, make sure you make sure your staff have access to all of these advanced technologies. Make sure your policies allow them to access those things when they need it, because some will, and you want to have that. But the biggest differences we will make in this country for cancer outcomes is lifestyle modification and early detection.
Great, thank you very much. Thank you to my panel today. You've been fantastic. Thank you very much. So it strikes me it's moving so fast and exciting times, as Tim just pointed out at the end. What can you do as an employer? I think create the right environment. Know your people really, really well, firstly, in case the worst happens, but actually encourage everybody to be fit, healthy, create the time for them, be flexible with them, and enable them to live their best life effectively in case the worst should happen. That brings today's session to a close. We had a great discussion today about the latest technology in cancer care and the importance of prevention, which is a good time to remind you about our flagship sustainability programme, Healthy Cities, which is returning in June. It's a fantastic way to encourage your teams to take up healthy habits, as we just talked about. If you'd like to get your employees involved in our 30-day movement challenge, please speak to your account manager and they'll help you out. And don't forget to keep an eye out for our follow-up resources, including our Bupa Academy materials and some brilliant employee content we've created with the partners at Jack on the topic of cancer. So that's it for Health Horizons this year, believe it or not. We'll be back in the new year with more insightful discussions. Stay tuned to find out what happens next. Thank you for joining us today, and we look forward to seeing you next year.